Gout, Things You Should Know, Questions and Answers by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Gout, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of gout. Chapter 1. 1. Is gout a common form of arthritis? Yes, gout is a common form of arthritis. 2. What is arthritis? Arthritis is the inflammation of the joints. 3. What is a joint? A joint is the place where two or more bones meet. 4. Can gout happen to anyone? Yes, gout can happen to anyone. 5. Does gout usually happen in one joint at a time? Yes, gout usually happens in one joint at a time. 6. Can gout affect more than one joint at the same time? Yes, gout can affect more than one joint at the same time. 7. What is the most common part of the body that gout affects? The most common part of the body that gout affects is the big toe. 8. What is the main cause of gout? The main cause of gout is hyperuricemia. 9. What is hyperuricemia? Hyperuricemia is the presence of too much uric acid in the blood. 10. What is uric acid? Uric acid is a waste product from the breakdown of purines. Chapter 2. 1. What is monosodium urate? Monosodium urate is the crystals of uric acid. 2. How is uric acid produced? Uric acid is produced when the body breaks down substances that contain purine. 3. What is purine? Purine is a natural substance found in the food we consume. 4. Are purines also naturally fabricated in the body? Yes, purines are also naturally fabricated in the body. 5. What are food rich in purine? Example of foods rich in purine are red meat, seafoods, etc. 6. What is a flare? A flare is the worsening of signs and symptoms. 7. What is remission? Remission is the moment when there are no signs and symptoms. 8. What is the cure for gout? Actually, there is no cure for gout. 9. What are the main signs and symptoms of gout? The main signs and symptoms of gout include severe pain, swelling, heat, redness, and limited movement of the joint. 10. Do the signs and symptoms of gout appear gradually? No, the signs and symptoms of gout do not appear gradually. The signs and symptoms appear suddenly. Chapter 3. 1. Is being male a risk factor for gout? Yes, being male is a risk factor for gout. 2. Is high blood pressure a risk factor for gout? Yes, high blood pressure is a risk factor for gout. 3. High blood pressure is also known as hypertension. 4. What is blood pressure? Blood pressure is the force that blood exerts on the arteries each time the heart beats. 5. Is obesity a risk factor for gout? Yes, obesity is a risk factor for gout. 6. Is diabetes a risk factor for gout? Yes, diabetes is a risk factor for gout. 7. What is diabetes? Diabetes is a chronic illness that causes high blood glucose levels and leads to complications. 8. Is metabolic syndrome a risk factor for gout? Yes, metabolic syndrome is a risk factor for gout. 9. What is metabolic syndrome? Metabolic syndrome is a combination of diseases such as hypertension, diabetes, obesity, etc. 10. Metabolic syndrome is also called Metabolic syndrome is also called Syndrome X. Chapter 4. 1. Is diuretics a risk factor for gout? Yes, diuretics is a risk factor for gout. 2. What are diuretics? Diuretics are medications that increase the production of urine. 3. Is alcohol intake a risk factor for gout? Yes, alcohol intake is a risk factor for gout. 4. Is fructose intake a risk factor for gout? Yes, fructose intake is a risk factor for gout. 5. What is fructose? Fructose is a type of sugar. 6. Is osteoarthritis a risk factor for gout? Yes, osteoarthritis is a risk factor for gout. 7. What is osteoarthritis? Osteoarthritis is a degenerative joint disease. 8. Is psoriasis a risk factor for gout? Yes, psoriasis is a risk factor for gout. 9. What is psoriasis? Psoriasis is an autoimmune disease of the skin that causes itchy rash and scaly patches. 10. Is heart disease a risk factor for gout? Yes, heart disease is a risk factor for gout. Chapter 5. 1. Is kidney disease a risk factor for gout? Yes, kidney disease is a risk factor for gout. 2. What is nephrolithiasis? Nephrolithiasis is kidney stones. 3. Is a high cholesterol level a risk factor for gout? Yes, a high cholesterol level is a risk factor for gout. 4. Are beta blockers risk factors for gout? Yes, beta blockers are risk factors for gout. 5. Is menopause a risk factor for gout? Yes, menopause is a risk factor for gout. 6. What is menopause? Menopause is the period that ends a woman's menstrual cycle. 7. Can gout lead to complications? Yes, gout can lead to complications. 8. What are the complications of gout? The complications of gout are kidney stones, recurring gout, damage to the joints, lumps under the skin, anxiety, depression, etc. 9. Can gout be treated? Yes, gout can be treated. 10. Who normally treats gout? Rheumatologists normally treat gout. Chapter 6. 1. Who is a rheumatologist? A rheumatologist is a specialized physician in treating inflammatory and autoimmune disease. 2. What is the diagnosis of gout? Gout can be diagnosed by a physical exam, blood tests, X-rays, ultrasound, joint fluid test, etc. 3. What are the treatments for gout? The treatments for gout are pain management, a healthy and balanced diet, reducing foods rich in purine, maintaining a healthy weight, reducing alcohol intake, having regular physical exercise, anti-inflammatory medications, and medications that block or eliminate uric acid from the body, surgery to replace joint, etc. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding gout.